Hey everybody, I have driven out here to
Howdy, y'all. In this video today, in today's Poop Tip Tuesday, we're going to talk about a couple different things. Number one, I'm going to give you my opinion on what anyone can do to help succeed in what you're in, whether you're a resident, a medical student, you're in your job, you're wondering exactly what your boss is looking for. Number two, we're going to talk about Ruth Bader Ginsburg and pancreatic cancer. What are some of the risk factors for that? How you can prevent this. Number three, we will talk about what are the worst foods for diverticulitis. A lot of people ask me this question. Hey, Dr. Islam, what are some things that I need to avoid? Number four, we'll go over a new study which talked about what are some of the worst drinks when it comes to acid reflux. And number five, I'm going to talk about exactly what tests I feel like are a waste of time when it comes to your gut health. So for those guys who are joining for the first time, my name is Dr. Islam, and yes, I am an actual poop doctor. My passion is to give you tips and tricks to help out with your health. Every Tuesday around this time, I do a live video on all the social media streams, answer questions you guys may have. Hey, if you want to have one of your questions answered, either comment down below and let me know what you want me to talk about, or subscribe to my weekly newsletter. I'll put a link down below. Send an email to me and I'll review those emails. Guys, I get a ton of emails and I appreciate you guys responding to me. I sift through all of them. I read through all of them. And they're the ones that I feel like would be great topics I'll talk about. A couple more administration things. Number one, if you haven't already, please smash that like button. Like, share, subscribe, do all that stuff so all the social media giants know that we're watching this video. And also keep in mind, I cannot and will not answer your personal medical issues. I may not be your doctor, and if I am, I'm not going to acknowledge that because there's certain constraints that I have, though I can't answer general questions that you guys have. But great seeing you guys. Amanda It was good seeing you. Thank you for watching today on the live video. Hamadas, good seeing you. Cruz, good seeing you as well. And Veronica, good seeing you guys as well. Thank you guys for watching on the live video. So let me know in the comments, are you watching this live on the replay, and where you guys are watching this ad. So today's a beautiful day in Lubbock, Texas. Hope some of you guys were able to go outside and go for a walk. I went for a run this morning. I absolutely loved it. For me, running is a form of meditation. You know, some people will use prayer. Some people will sit down and actually meditate. I have found for me that either running or walking, and I actually do it with silence, helps me to meditate, helps me to think, and also gives me the ideas that I need. This is where I kind of get up all the ideas that I'm thinking about. I go through the problems that I'm having. I go through some issues that may be bothering me as well. And this is a really effective way that I have found to help me really solve and get better ideas for what I want to do with my personal life, my career, and what else is going on. Let me know in the comments what you guys have done as well to kind of get you past some of the hurdles that you guys may have. Also, I'm going to let you know I am reading a new book. This is called The Life of Andrew Carnegie. I am a big fan of reading really big biographies. I just finished one a couple weeks ago on George Washington. I finished one before that on the making of Uber, which actually was a great book. And now I'm delving into Andrew Carnegie. For those guys who don't know him, he was one of the richest men in the world. He was really big in producing railroads. And he gave away a lot of his money. And I'm reading some of the lessons for this. I love to read big biographies because it really gives me at least some really good information and some insight about how people dealt with problems that they may be dealing with. And you'd be surprised, the problems in the 1800s are still the same problems we're having today. How to deal with wealth, the inequality between the rich and the poor, how to succeed in your career and what you're doing in. And so I find reading these books are fantastic. Let me know in the comments if you have a recommendation for me to read. I love reading books. I try to read at least one book a week if I can. One of the things I realized kind of reading this book on Andrew Carnegie is just the vision that people like him had of where the world was going to go. And so Andrew Carnegie, he realized that the world was going to be going into a steel fashion. You know, steel was going to be one of the biggest things that are going on inside the world, whether it comes to steel railroads, steel bridges. And so he pivoted his business to take advantage of that. And I think just having that vision and looking beyond the horizon for what is going on is a very key aspect when it comes to really succeeding in life and what you want to do. Margaret, it's good seeing you. Thank you for watching today on the live video. And Margaret, great. I am glad you're walking for at least 2 miles every single day. That is fantastic. You deserve some praise. So I want to talk about one thing, my number one topic, which is how to succeed in life. So I get a lot of questions from a lot of either people who want to kind of do what I'm doing, whether it's residents, medical students. I'm also the boss of my practice as well. So I get questions whenever I interview people, how could I succeed? And I also get a lot of just people, people who come to me who say, hey, Dr. Islam, I kind of want to get where you're at. How do I succeed in life? And I will be honest with you, I thought about this for a lot. You know, what makes people successful? Here is kind of what I came up with. It's pretty simple, but you'd be surprised how many people don't do this. And I will almost guarantee you, if you do this where you're at right now, not only will you succeed, you will go beyond where you need to. Number one is that you have to be very dependable. And what I mean by that is you have to get things done whenever somebody says you need to get it done. So if I say in a conversation, hey, I need something done, you are the type of person that I can depend on that knows will get it done. I know that if I say something in a conversation, if I say something in the meeting, if we're doing a project, I can depend on you to get it done. I don't have to worry in my mind that, is this person going to get this thing done? Is this person going to get the thing I need to get accomplished? Is he going to forget? Do I need to follow up with him or not? You are dependable. So many people in life are just not dependable and they don't get things done. They tell you they're going to call you back. They don't call you back. I had this experience this morning where I was in a phone conversation with somebody who told me, all right, Dr. Islam, I'll get back to you at the end of the day with the next step. Guess what happened? Didn't get back to me. Completely not dependable. And there's so many people who don't realize how important that is for somebody who who needs that work done. If you want to succeed, you need to be dependable. So easy, people just drop the ball on that. But also number two, beyond that, once you become dependable, you can become indispensable. And what I mean by that is when you get to a point in time where I have the confidence to believe in what you're saying and know that you're going to come through with that, that's when you can start to make these suggestions and the changes that make you indispensable, that make you part of the team, that make you a critical part of what we're doing. Because I know that I can not only depend on you, but your ideas are based on sound judgment, and the ideas that you have can get you further in life. I have found that people who succeed in life are those that can be dependable and then can become indispensable. And by doing that, I can guarantee you where you are in your career path, no matter where you are, you're going to skyrocket up to the top and be one of those who's going to be at the very best at what you can do, because this is exactly what a lot of people don't do. And by doing this, I think you're going to do very, very well. Let me know in the comments what you guys think about that. I'm curious about that. Harry, it's good seeing you as well. Thank you for watching that as well. So thank you on the live video. All right. So let's talk about topic number two, pancreatic cancer. So you may have seen the news about Ruth Bader Ginsburg passing away from pancreatic cancer. You may be wondering exactly what is going on. So pancreatic cancer is it's a pretty common cancer, and we're seeing this more and more in individuals as we get older. So typically, pancreatic cancer is not a cancer that we see in people less than the age of 50 years old. It is typically seen in much older generations, 60s, 70s, and 80s and beyond. So typically, it's a cancer of old age. Now, unfortunately, when it comes to pancreatic cancer, it doesn't cause a lot of symptoms, which is why we typically cannot catch it very, very early. And by the time you have symptoms, usually it's already too late. The most common symptoms being kind of some pain, some weight loss, maybe you don't feel so good, your appetite's not doing so well. And as you can tell, those are very vague symptoms. That can be anything, and it's hard to know exactly what that is. Now, if you get to a point in time where actually you become yellowing of your skin and have problems like that, we know at that point in time it's already spread. And the difficult thing about pancreatic cancer is that there are no screening modalities currently that we do for most people. There's no routine colonoscopies, no routine imaging that we do for pancreatic cancer. So by the time we find it, unfortunately, it already is at a stage where it has metastasized. And you may see a lot of people who are older who actually may have pancreatic cancer. Now, a couple of things that we're realizing. Number one is that we're seeing the pre-cancer of pancreatic cancer for a lot of our patients, which are typically pancreatic cysts. And we see these cysts not because we're looking for it, but because we're doing imaging for something else. Let's say I'm doing an imaging for around the belly, maybe for some chest pain. I just happen to see a cyst in the pancreas. Well, that cyst has the potential to go into pancreatic cancer, and we can typically do investigation, do evaluation, and maybe prevent that risk from occurring. Here's what you need to know about what you can do to decrease your risk for pancreatic cancer. Number one, you got to stop smoking. Smoking is one of the worst risk factors for pancreatic cancer. It jumps up the risk so much that if you just stop smoking, you decrease your risk exponentially. Number two, if you're drinking alcohol, you need to stop or at least minimize. Alcohol itself can cause toxins inside your pancreas to cause inflammation. And the combination of smoking and alcohol is almost a 10 times risk factor for developing pancreatic cancer. So you need to make sure you can stop or minimize that. Number three, if you have a family history of pancreatic cancer, especially if it's a first-degree relative, it may be worthwhile for you to talk to your healthcare provider about whether you need to get screening for pancreatic cancer, maybe even undergoing some genetic testing as well. And number three, if you can minimize some of the foods that can cause you to have a higher risk of developing cancer, foods that are high in fat, foods that are high in red meat, and foods that are low in fiber are typically the risk factors to make pancreatic cancer worse. So these are some of the things that I recommend to help prevent your risk for pancreatic cancer. Kathy, it's good seeing you. Thank you for watching on today's live video. So let's go on to topic number three. What are the worst foods for diverticulitis? So many people ask me this question about diverticulitis, mainly because they have heard some of the things that you may have heard about things like nuts, seeds, popcorns, items like that. So let me know in the comments below, have you heard about that? Or have you heard, does that increase your risk for diverticulitis? Because I can tell you the answer. The answer is no. We have no clinical evidence that foods that are high in seeds, nuts, popcorn increases your risk for diverticulitis. So if you enjoy that, go crazy. It's not a big deal. It's perfectly fine. But we had a recent study came out in the past couple of weeks which looked at some of the foods that can increase your risk for developing diverticulitis. Can you guess what those foods are? Comment down below and let me know what you guys think what some of those foods are, because you may be surprised about what some of these foods are, and by minimizing these foods we can actually minimize or decrease your risk for developing diverticulitis. So we know that the foods that can make your diverticulitis worse are foods that are high in fat and low in fiber. Yes, these are the biggest things that we know that can make inflammation of your colon much, much worse. So here are the foods I recommend to improve your risk for diverticulitis, to prevent this from coming back. This is more important than all the nuts, seeds, and popcorns and anything else like that. Number 1, green leafy vegetables. That has a lot of fiber in it. It has a lot of antioxidants in it. It is good for you. Good for your gut, good for your colon, good for your heart, good for everything, but it's also good to prevent your risk from diverticulitis. Keep on with those greens. Number 2 are dark yellow vegetables. Once again, high in fiber, low in fat, and also high in antioxidants that can help decrease your risk for developing inflammation of your colon. Number 3, coffee or tea. Yes, there is so much benefit with having coffee and tea in terms of overall health. It can improve your cognition, decrease your risk for Alzheimer's. It can also decrease your risk for fatty liver, and can decrease your risk for diverticulitis. So if you are wondering, what can I do to help improve and help out diet-wise with diverticulitis? Vegetables, green and yellow, coffee, tea. These are the big ones. Now, on the opposite spectrum, what are things that can increase your risk diet-wise for diverticulitis? So we know that red meat increases your risk for diverticulitis. There's good evidence that red meat produces inflammatory reaction inside your gut. It decreases the good bacteria, increases the bad bacteria, which are the pro-inflammatory bacteria, and that cause a cold change in the gut microbiome, making it more towards an inflammatory state, leading to diverticulitis. Number 2 are refried grains. This also causes inflammation, change in the gut microbiome, decreasing the good bacteria and increasing the inflammatory bacteria as well. And number 3, sugary beverages. I mean, come on. These may taste good, but they are not good for you. That also changes the gut microbiome. This is going to be vastly more important than some of the things you may have seen about avoiding seeds, nuts, and popcorn. So guys, make sure you can do that. So Stacy, good question. Yes, the answer is actually red meat. Yes, the evidence seems to suggest that red meat can actually increase the amount of inflammation. Okay. Margaret, great question. Decaf, okay. The answer is yes. And so far the evidence does not speculate whether it's decaf or caffeinated. So if you enjoy decaf, go crazy. Now, the important thing about coffee and tea is that it's not coffee filled with sugary things, okay? You're kind of negating the fact it is black coffee and typically tea without a lot of cream and a lot of sugar in them. Great question, guys. So let us go into the next question. What are some of the drinks that can cause heartburn? So very good question. This actually was a study that was done last week in which we have good information on. And so what do you guys think? I'm very curious. What do you guys think are the drinks that can make heartburn symptoms worse? Sorry, I'm just going through the comments here. All right. So if you had to guess, and I think you guys kind of know this, we know that I mentioned coffee, but unfortunately coffee can sometimes Oh, good job, guys. Good job. Oh, man. You guys are right on top of it. Elizabeth, great. Michelle, fantastic. Cruz, oh, man. You guys are on top of it. Michelle, that is really, really good. Oh, that's great. Okay. Great answers. You guys are on top of it. I don't even have to do this live video because you guys already know the answers. That's great. Well, let's go over it. So, 3 drinks we know make reflux symptoms worse. Unfortunately, it's coffee. Yes, I know. I just mentioned that coffee is great for you for everything else, but it can make reflux symptoms worse. What happens when you drink coffee is that it actually causes the valve between the esophagus and stomach to be open longer to cause that acid to flip up and cause worsening heartburn. I know. I'm sorry. Coffee is great for everything else except for heartburn. I know. Number 2, the other drink that can make reflux symptoms worse is tea. Yes, I know. I just mentioned that, how tea is good for diverticulitis, good for your liver, but it may be bad for heartburn as well. I'm sorry about that. And number 3, you guys hit it, sodas. Sodas have been found to be worsening for your acid reflux as well. Now, I can tell you what drinks are not going to be worsening for your heartburn. Number 1, obviously, water. Water is fantastic. And if you substitute water for anything else, this will decrease your risk for heartburn. Number 2, you may be surprised, is juice. And so a lot of people come tell me and say, hey, can I take some citrus juice like orange juice or apple juice or any type of juice like that? That juice does not increase your risk for heartburn. And so if you are one of those that tends to enjoy juice drinks and you're worried about heartburn, you can know that based on the study that we have so far, that juices do not increase your risk for developing heartburn. That should be okay. So 3 drinks that do: coffee, tea, and sodas, boo. But the 3 drinks that don't: water, juices. I forgot the number 3. Number 3 is going to be milk. Those are the 3 that don't do that, guys. So thank you guys for watching. Yes, Marla, you're exactly right. Tea gives me heartburn as well, and I have the same issue as well. All right. Last question before I go into your live questions. Number 5. Somebody asked me, hey, Dr. Islam, which test do I think is a waste of money and time? So I love this question because I have so many people out there who are confused about some of the tests that are out there. Stool testing for certain things, allergy testing for certain things. Here's my opinion, and my opinion is based on evidence. Number 1, food allergy testing is a waste of time. Don't do it. It doesn't give you any good information. Basically, you're going to be allergic to everything, and then what are you going to do? It's completely useless. It doesn't make any sense. There's no standards that we use to help determine exactly what you are allergic to. Don't do it. Don't do it. Don't do it. Number 2, any type of stool testing that helps check how your gut microbiome is to see if you're out of whack and what to change for it. Guess what? There is no evidence at all that actually plays any clinical benefit. If I have a patient spend $500 on this test that test your stool to see if you have parasites or bad bacteria in it or seeing how your microbiome is, I have absolutely no idea what to do with that information. And guess what? The people who made those tests have no idea as well. That is complete waste of time, and I don't want you to have to worry about wasting your time for that. Number 3, any type of other blood tests that tells you, besides food allergy testing, any other blood tests that tell you you have a particular disease like celiac disease or Crohn's disease. So you may see some of these blood tests that are out there, which report to tell you, hey, this can be diagnostic of a colitis, Crohn's, or inflammatory bowel disease, or irritable bowel syndrome. Guess what? The data is not there. We do not have those tests that allow us to see if you have these particular conditions. So don't waste your money. Don't waste your time. I'm telling you, the best way for us to know is you to see somebody who specializes in the gut, somebody like me, or a good primary care provider who can help you out with some of the gut issues that you're having. All right, great question. So I'm going to go through some of the live questions you guys have. Thank you guys for watching today. Veronica, how do I have time to read, run, and be a doctor? Well, number 1, I have a great wife who helps out with a lot of things. I mean, she's fantastic. Number 2, I am a big planner. So I plan literally everything to the minute of my day. And I found if I can really time block every single activity in my day to the minute I can get everything I want to get done, be a doctor, take care of my patients, hang out with my family, read a book, do these live videos, do my YouTube videos, do everything I can. I really, really am very particular about that. If you're interested more in terms of my productivity, please let me know in the comments down below. I love talking about things like that. It really gets me going. So Harry asked a question, how much water a day should I drink? So, we really don't have a lot of good, when it comes to the evidence for this, we don't really have a lot of good evidence for exactly how much water somebody should drink. We just don't know. I can tell you what I usually tell my patients is that you want to drink enough until your urine is basically clear, and that means you've had enough water. Obviously, if you're thirsty, drink water. You should try and drink as much water as you can. But in terms of the actual amount, we really don't have a good idea. But usually I tell my patients, try to drink as much water as you can until your urine is basically clear. So Elizabeth, great question. Does aloe help any? So a couple things. So we have pretty good evidence that aloe can help out with some gut issues, whether it's irritable bowel syndrome or reflux as well. But we don't have a good evidence for that. Aloe typically is very safe in most cases. However, before you try anything, I would highly recommend, in fact, I would insist that you speak to your healthcare provider, because you may be one of those that may not benefit from that, or you could have a side effect from that. So just keep in mind. All right, Terry, it's great seeing you. Perfect. Well, guys, Heath, good question. All right, I want to pull this up. Poop question. All right. Is a good caliber of poop at least a quarter round? Well, I'm your poop guru, guys, so let me talk to you about poop. So, like everything in GI, we have pictures, and we have pictures of great poop. So if you Google Bristol stool scale, you will see a scale of poop, exactly what your poop should be. So I have a video on this on my YouTube channel, but what your poop should be. But in essence, your poop should be Bristol stool scale 4 to 5, which is the golden poo. So I'm going to describe poo right now. My favorite topic, poo. It is long. It is together. It has very little splash, and you feel so great afterwards. That is a Bristol stool scale 4 to 5. Google that. See the pictures. That is what exactly is a great poo. Michelle, great question. How do I feel about kombucha? Sorry, I always say that wrong. So kombucha is a prebiotic. Prebiotics are foods to help to feed the good bacteria that's already inside your gut. It actually helps to improve what is going on there. It actually augments what is going on naturally inside your gut. There are a lot of prebiotics that are out there. Kombucha is one. Sauerkraut's another. A lot of them that are out there. My recommendation is kombucha is great. It's a great prebiotic. So if you're trying to change your gut microbiome, if you're trying to be healthier, if you're trying to improve yourself, decrease inflammation, get yourself feeling better, taking prebiotics, which are foods to help feed your gut, is fantastic. Kombucha is one of those that is really, really good. Now, keep in mind, some kombucha has caffeine in it, so it may actually jack up your caffeine intake. So kind of be aware of that. I personally don't take kombucha because I don't like the taste of it. I do other prebiotics instead, but I have a lot of patients that do that. They actually make their own, and that is fantastic. It is a great prebiotic to help out with your gut issues. Let me know in the comments down below if you want me to do a video or a live video on prebiotics, probiotics, symbiotics, all the biotics that are out there. I can do a video on that. Also, let me know in the comments if you want me to do a microbiome video as well, because I have found in my studies that your gut microbiome really is the difference when it comes to living a healthy life, feeling better, improving all the inflammation that you may be feeling going on. I have become more of a plant-based physician. I have seen the changes in my life. If you've seen my newsletter, I did a newsletter on this where my cholesterol changed dramatically just by changing to a plant-based diet, and I feel so much better. So Terry, yes, does exercise actually help a person poo? Is it safe to exercise after eating? So the answer is, for number one, Absolutely it does. So your colon needs to move. And one way of moving things in your colon is to exercise. Get up, moving around. There is very good clinical evidence that physical activity helps to stimulate the colon, push things through, move things around, and to help improve your colon transit, move things through. So yes, it does work. I would say it is pretty safe to exercise after eating. Obviously, you keep in mind you can get stomach cramps, you may not feel so good. But for me, I have found that I cannot exercise on an empty stomach. So usually I'll have a small little snack, then I'll exercise. But yes, exercise is fundamental in terms of helping you use the restroom for sure. So Cindy, great question. What is my opinion on inulin as a powder prebiotic? So inulin works very, very good. I'm a huge fan of that. And I found that for a lot of my patients, they do so much better with that. So yes, I'm a big fan of that. It is an effective prebiotic. It works really, really well. It also helps to, sorry, I'm trying to change the font here. It also helps to improve the gut microbiome and make people feel so much better. So yes, I am a huge fan of that. Great question, Cindy. Good question, Michelle. So you want to see a video on how to get rid of oneself of medications prescribed. So I'll tell you a couple things. Number one, if you saw my last newsletter, I want to be the physician that gets you off your medications. I really do. And I feel strongly for this. A lot of our chronic diseases are based on bad eating habits, bad health, bad food. And I found that if we can change our diet and improve our lifestyle, your blood pressure will get better. Get off your meds. Your cholesterol will get better. Get off the meds. Your everything else will get better. We can get you off your meds. Your diabetes meds can go down. And I personally have found that the most effective diet, and the research seems to back this, is a plant-based diet. And this is what I've been preaching more and more to my patients. And I've found this to be such a great change in terms of improving your health to get you off your medication. So yes, that is my goal. I want to get you off your meds. I want to get you feeling better. I want to try and improve things naturally through food as much as I can. All right, perfect. All right, guys, thank you for watching. I appreciate it. Great job. I really enjoyed this today. Let me know in the comments if there's any other topics. Please, if you haven't already, do two things. Number one, like, share, subscribe, do all that stuff so all the social media giants can see what's going on. If you know somebody who may benefit from this video, share it with them. And number two, if you haven't already, subscribe to my weekly newsletter where I give you all the great topics and tips that I'm talking about. Thank you so much for watching. I really do appreciate it. Hope you guys have a happy, healthy, and wonderful day. Have a great day, guys. Thank you so much.